I'm Dr. Brian Heil of Premier Plastic Surgery. I'm a board-certified plastic surgeon in Pittsburgh, Pennsylvania. Patients will often come in and say that they don't want to look so tired or haggard. They don't know exactly why, but they feel that their face doesn't reflect their emotion and their attitude. This is often due to sagging and settling of structures in the upper face region with the brows, the eyes, in the mid-face region with the nasolabial folds, with the cheeks and the jowls, and sometimes in the neck, the typical hanging neck or turkey neck, and sometimes a fullness or heaviness in the neck. I typically like to talk with patients from a top-down approach. In your consultation, we'll begin with your forehead and your brows and your eyelids, and then discuss your face, your cheeks, and then move to the jawline, the neck. We can analyze what components add to this tired or haggard look. As we begin, we look at the eyebrows. Sometimes these are deep set, sometimes they're flattened and unarched, sometimes they crowd and hide the openness of the eyes. This can be treated with what we call a brow lift. There are many approaches to brow lifts. However, most patients are able to be treated with an endoscopic brow lift. This is accomplished through tiny incisions that are hidden above the hairline. With cameras and longer instruments, we can work from these small approach holes and do our work down at the brow. The brow lift is directed at two major components of the upper face. One is the tightness and scowling look of the central part of the eyes, which we sometimes treat with Botox. The endoscopic brow lift allows us to resect and relax and release this tension by removal of portions of these muscles. Although some of these can reform or regrow over time, this typically gives a smoother, more open look to the central part of the face. It relieves some of the tension look that people walk around with even when they're not scowling, even when they're not serious. The other component of a brow lift addresses the outer brow. The brow can sit low, can flatten, or even sag into the upper eyelid. The brow lift, whether done open through larger incisions or endoscopically through the small incision, allows us to reshape the brow, not into a surprised appearance, but into a beautiful, shapely proportion that complements the orbit in the eye. Secondly, it allows us to bring this into a better position. So by attaining a more aesthetic and natural shape and position of the brow, the eyes are allowed to be seen better and not give as much of a tired look. We have a modular or component-oriented approach to the face so that we can address the components that matter most to you, but we'll discuss all the components so that you'll understand what gives you the look that you have and what can help you accomplish the changes that you seek. Moving to the face and the neck, patients often complain of heaviness in the cheek folds and fullness in what we call the jowl region. As the jowls become more full, lines form on the sides of the mouth, going from the corners of the mouth to the jaw. We often call these puppet lines or marionette lines. Not such a complimentary term, but patients are well aware of this if they have this problem. The neck sometimes has laxity, looseness in skin, crepiness, or sometimes just fullness of fattiness underneath the chin. In the middle-aged person who has primarily facial heaviness and sadness and tiredness around the mid-face, we find this is often due to descent and relaxation of the deeper structures of the face, followed by the skin relaxing and hanging over the folds and the attachments of the muscles. This can be approached with what we call a facelift. A facelift does not necessarily mean that we're treating the brows, doesn't mean we're necessarily treating the eyelids, and it doesn't necessarily even mean that we're treating the neck. At younger ages, a mini facelift is appropriate, and this can allow us to address just those concerns in the mid-cheek and in the lower cheek and jawline area. Whether it be a mini facelift or a full facelift, the work, although it's done in the cheek and jawline, it's approached through small incisions placed in the creases around the ears. When possible, the incision can be hid within portions of the ear and behind what we call the tragus. The remainder of the incision can extend up behind the ear. This is shorter and sometimes not even existent in a mini facelift, whereas a full face and neck lift to address neck concerns requires us to extend that incision behind the ear and hide this in the hairline. We avoid very specific stigmata of facelifting, which can be seen picked up easily at a conversational distance at a cocktail party. These stigmata often involve raising the hairline unnaturally, pulling and tethering the earlobe into a pixie ear or a non-natural position, and the posterior hairline behind the ear can show step-offs or zigzags. Any of these components can be avoided with careful surgical planning. My approach to a facelift is typically a two-plane approach. First, we lift the skin up to access the deeper structures, called the SMAS. The SMAS layer allows us to lift and rejuvenate the structure of the face and reposition the laxity of the cheek, the jawline, the jowls, and into the neck laterally to the side. The excess skin can then be addressed by advancing the loose skin of the face and the neck towards the ear and behind the ear. If the neck is not very loose, the behind the ear incision can be avoided. The mini facelift involves resecting excess skin just from in front of the ear after the deeper layers are rejuvenated. If a neck lift is performed, once the deep layers of the neck are tightened, the excess skin is then taken out and removed along an incision hidden behind the ear. In some cases, a small incision is made underneath the chin. Sometimes this is used to tighten and strengthen the muscles of the central part of the neck. If this is not a problem in your neck, then we can avoid access from this under the chin approach. If there is just fullness in the neck, this can sometimes be reduced with liposuction, which is combined with a mini facelift technique. The full neck lift is not necessary in those cases. The last component often complained about by patients is the lip lines around the lips, but these can be addressed typically by laser resurfacing, whether it be deep resurfacing or a fractional resurfacing. Recovery can be much more rapid nowadays than in years past that involved months and months of recovery. Typically, laser resurfacing that can be combined with face and neck lifting or done separately involves a 1 or 2 week recovery, and sometimes even less if the lines are less severe. Overall, we'll meet with you and develop a comprehensive approach to your facial rejuvenation. Your facial rejuvenation involving brow lift and/or blepharoplasty and/or face or neck lift or mini facelift will be performed in our Quad ASF Surgical Center. The duration of your surgery will depend on what components we're addressing. A mini facelift may take approximately 2 hours. A full face and neck lift might take 3.5 hours. If we're addressing the brow, most brow lifts take about an hour. Eyelids can add about an hour to an hour and a half. If we're treating the entire face, involving the brow, the eyelids, the face, and the neck, then we choose to perform this in a nearby outpatient hospital surgical facility. Otherwise, the shorter procedures can be performed very safely in an outpatient surgery center. Your recovery from facial rejuvenation will primarily vary with the extent of the dissection, the number of components of the face treated, and how you personally heal. Some patients recover within 7 to 10 days from many of these procedures. Others can take 2 or 3 weeks. Although we can't guarantee or predict exactly how you will heal, we can usually give you a good idea of what to expect based on how much you're treating and how we're approaching it. I look forward to meeting with you and helping you plan out how to reach these goals.